Hello, everyone, and welcome to RevMD Sexbytes podcast with me, your host, Dr. Deborah Durst. So I launched Revitalize MD in 2017 with the mission to help people comprehensively look, feel, and function better. And what I discovered is a whole nother field of medicine, sexual medicine, that I didn't even know existed. So as we got people feeling better or hormonally optimized, I realized that there's a lot of things we can do with any kind of sexual issues that men or women might be having. And so I want to bring this podcast, live to basically try to reach more people so they can hear about all these amazing services. I have a guest here with me today, Ellen Phillips, and she is a friend and a patient. And again, we develop a lot of friendships with our patients because they're in frequently, and we get to know them very well. They get to know us well. And so she was willing to actually talk to us a little bit about the procedure she had done. And that allows us to express, kind of the feelings or apprehensions or fear. And you can learn more about the procedure. So Ellen, do you want to introduce yourself?
Well, you just kind of did, but I'm Ellen Phillips. I'm a pharmacist. I've been a pharmacist for 23 years. I actually own Believe RX and Believe Our Extra, and I'm happy to be here today.
Thank you for being here. And speaking of which, I was supposed to go on a fast today, just being transparent, but Ellen has Believe Our Extra, which is in Believe RX, and they do smoothies and healthy smoothies, and they do these bowls that, of course, are healthy too, and you can get all kinds of different bowls. And she was bringing one, and I love them, so I'm putting my fast on hold. So anyhow, transparency. But so Ellen, tell us a little bit about, what brought you to Revitalize MD for the first time.
Internet search.
Okay.
Over a holiday.
All right. And what were you searching for?
Vaginal rejuvenation.
Okay. And it's interesting, I think, that a lot of times what we'll search for might not be ideal hours or open hours when it kind of bothers us. And then, but being able to get in touch with an office or, having them follow up with you and actually making the appointment and talking about the services, because a lot of men will actually call late night when something is obviously an issue. So,
well, I would have forgotten about it had someone not text me from the office.
Okay.
To schedule the appointment. And before I knew it, I was having the works.
All right. Well, tell us a little bit about the works.
Well, so I had Votiva, which is it? Tell.
So vaginal rejuvenation with a laser. So
radio frequency waves, or
that is radio frequency using heat, non-ablative, which is the preferred vaginal treatment that I like to do with lasers, because it doesn't ablate the tissue in the vaginal canal. And so we don't really know what the long-term effects are of that. And so when we're talking about vaginal rejuvenation, that's one of our machines, and Votiva is the one that Ellen had. Not painful at all.
First results are amazing.
What were some of the symptoms that you might be feeling? And again, as we age, it's pretty much the same for women. The issue is that they're afraid to talk about it. And Ellen is very open to talking about things, just like I am, and a lot of our patients actually. And so, but we want them to be comfortable talking about it, because dryness or pain or urinary incontinence or just decreased orgasmic strength, which is so common. These are some of the treatments that help with that. And women don't want to talk about that. And they also don't know that there's necessarily anything you can do about it. So what were some of the symptoms that you were feeling?
Most importantly, I felt dead.
Okay.
Like give it up.
All right.
And then, the urinary problems that you have as you get older.
Well, and the decreased sensation is so common. Mm-hmm. And again, I think it's more objective for men, because there's actually functional changes that you can see aren't happening, where with women, it's not like that. And so I think a lot of women, number one, it might be a little insidious, where they don't notice it. It's not an overnight. And for some of us, it's a little bit faster. But likewise, they tend to ignore it, thinking they'll accept it because there wasn't much you can do about it. But how did you find out that there was? What were you on a mission, on the search for? Did you know that there was things out there? Or how'd you hear about vaginal rejuvenation the first time?
For years, there's been different things out there. But I have studied it for years, because as you get older, you don't do something to prevent it, then you're there before you know it.
And it's just a matter of time.
Yeah.
Well, and Ellen, of course, is super smart and she's on top of things. So, but vaginal rejuvenation has been talked a lot about, and even FDA has come out a couple times and talked about lasers not being a good option. But again, I think that because it's a non-traditional method of treating something that a lot of times it's just that they don't know. And so they want to protect the public, which I agree with completely. But I think that the non-ablative is definitely the way to go, because you're not ablating tissue, just heating it. So,
and you look up all of that when you're researching it. But people, if I said something to somebody about it, they would be like, well, I heard so-and-so had it and they weren't happy with theirs. But I have to say I'm very happy with mine.
Good. Awesome. And you had the Votiva and then the ohsot combination on the first visit.
And it was, the results are amazing.
The ohsot is amazing. And what about pain in addition to, like with either one of those, did you have any pain?
Not at all. I was really surprised because I was really nervous for no reason.
Every woman is nervous. I think as much as we tell, because I'm sure I said it was painless, or it was comfortable. And a lot of people are not going to believe that until they actually go through it.
Right.
Because
I'm glad I did.
Yeah. When you're talking about putting needles in, areas that needles aren't typically going,
It's
you would think
thought.
so. Yeah, just the thought. But did you have any discomfort at all?
No.
Okay. And it's amazing and again, I've had these procedures done, and even though needles are going in, and we'll talk a little bit more specifically about where those go, we have been doing it for long enough that the discomfort is very minimized, if not gone completely.
Mm-hmm.
Now, how long has it been since you had your first treatment?
2 months.
2 months. Okay. And so again, I typically say anywhere from 3 weeks to 3 months each treatment, starts to take effect 3 weeks to 3 months. But you were having some urinary incontinence, right?
Yes.
And did you get improvement in that right away?
Yes.
Okay. And that's what a lot of women say. I don't like to set that expectation, because then we have some women that will come in expecting that. And to me, scientifically, that still doesn't make a lot of sense, because we're putting in PRP and it's going to go to work on the body. And, that's why I say 3 weeks to 3 months. But a lot of women have improvement in urinary incontinence, like immediately.
It was. So then by the time the second visit, I had Samantha schedule me as soon as possible, get it done, because it really helped tremendously.
Great. And then it actually is very cumulative. So, and again, we can focus in on one of the reasons that we have 2 laser machines. And one of the reasons why I like the Votiva is we can focus that in, where the other machine will actually do all the work. That laser will do all the work for you. And again, I think I look at that more from if somebody is uncomfortable with any laser maybe going in and then coming out during the treatment, and it's not, nothing uncomfortable or awkward, but there's a probe that goes in with the other one and the laser just spins around. So that's one of the differences. And then the other one does a little more pigment probably on the outside, where this one we can tighten, we can hit the clitoris with it. And then again, not painful at all. It takes about 40 minutes, right?
Right.
And then it actually adds to the effects of the first one.
And while you're down there, get it done.
Get it done. I know. When we typically do the ohsot on the first Votiva. So what I like to say, and Ellen already heard it, because when we meet the first time, we'll talk about, again, what happens if you're having symptoms like Ellen is, first people are searching, for ways to improve it. And then urinary incontinence might be one of the things they're searching for. If you can think of some other things, Ellen, like decreased orgasmic strength.
Yes. I mean, anything after vaginal birth.
Yes. Vaginal pain,
Menopause,
dryness,
yep.
menopause. How many children have you had?
2.
2. And vaginal deliveries too?
Mm-hmm.
So I say, like, the weight of the pregnancy coming down from the abdominal wall onto the pelvic muscles is going to weaken those muscles.
Absolutely.
Obliterate the space in between the urethra and the anterior vaginal wall. And so that's where we're putting the PRP and focusing those laser treatments so that we can get improvement in collagen elastin, support of the urethra, increase nerve and blood vessel flow, so the orgasmic strength is significantly improved with those treatments. So. Yeah. Mm-hmm. And again, when you go from having orgasmic strength to slowly losing that, and it's not objective with women, so no one else is going to know but us.
Right.
Women are very good at faking it otherwise, right?
Right.
So only we know. So we have to be proactive and look for ways to improve that, because nobody else is going to notice that change but us.
And why do it if it's not good for you?
Correct.
Right. That's the way I feel.
Well, and that's, I think, what a lot of women feel like. So again, hormonal optimization is one of them. And again, that's a drive. How was your drive prior to us doing all of?
Dead.
Yeah. Yeah. And so again, hormones, like when we're talking about local treatment, and that's what this is, regenerative local treatment on the actual vaginal tissue, or clitoris and labia minora, majora. So we're hitting that whole area. That's going to improve arousal, sensitivity, again, that urinary incontinence, and some drive, but you have to have that cell health optimal, and hormonally optimizing as well is key, because, again, if that's not there, you're still not going to have the drive or desire to have sex. And so they work together. And then, testosterone optimization. So, you being a pharmacist, are there any products at all for women for testosterone, approved?
Not in the pharmacy, no.
Yeah. Yeah. And it never has. And so they have the manufactured, tests, and I even forget what the name of the gel is for men. And then they have, injectable forms, but mainly still aimed at men with higher concentrations. And so nobody really talks about testosterone need in women. Right?
Not at all.
But it makes a huge difference.
It really does.
Yeah. And so again, brain fog, what are some other symptoms that you think you might have contributed to even like hormonal changes?
Well, high estrogen. I really had gained a lot of weight and barely ate anything. So it just felt like a blob. So
those changes that happen over time, that again, we are doing all the same things we did before. We're eating the same, we're working out the same, but now we're starting to gain weight. So again, if we sit like a bunch of women around a room, literally they will all be nodding their head.
Yep.
Me too. That's the Me Too movement around the room. Yes, me too. I'm having those symptoms. And that's one of them: weight gain, body composition changes. And again, that's excess estrogen, low testosterone, a combination of them both. What about brain fog? Were you having any brain fog with it?
Probably. But more than anything, just the weight gain. Well,
she's sharp, so she doesn't like. A lot of us will actually experience it, but sometimes it's more insidious, and so you don't. Energy wise, did you feel like you noticed a decline in energy at all? Oh
yes, absolutely. I just felt like a blob.
All right, yeah, because you didn't want to work out then as much, as tired at night,
and then you get so heavy. I mean, I got so heavy, it was uncomfortable. And I've never been like that, not even when I was pregnant. So
yeah, and then it's hard to work out when you're tired, you're gaining weight, and again, women all go through it. And I think the most important thing is that women know that they're not alone.
Right.
I feel like there's a huge gender bias when it comes to testosterone in women.
So when I saw you, I was talking to you about the weight gain. You're like, I'm not even worried about that at all. We got this. So, and you do.
Well, and you're doing your part too. I love, because again, testosterone will make you energetic enough. You can work out, and then again, you'll build muscle again, and and feel better.
I feel great.
Have sex drive, want to have sex. And then, the local treatments are very good at, again, regenerating. So the ohsot a little bit. We'll talk a little bit about that. You were nervous.
And you think about where the needle's going, of course.
So with the ohsot, if anyone doesn't know, we're using PRP. And so when we're doing PRP, we're talking about spinning or drawing your blood, spinning it down, and getting the platelet-rich plasma part. That's what PRP is, platelet-rich plasma. Ellen already knows this, and then we've also talked about it since, and then platelets have growth factors in. And so we're re-injecting those growth factors into tissue to get regrowth of nerve and blood vessels and stimulate collagen and elastin. And we do it in all kinds of different tissues, hair, face, but again, clitoris, the G-spot, anterior vaginal wall, which actually goes right through the G-spot, and then nipples. Did we end up doing nipples for you too, right? Yeah. which makes a huge difference
yes.
as well. Yeah. The nipple PRP is amazing. So if you have decreased sensation vaginally, you're having decreased nipple sensation as well. And so with that, if we put PRP under there, again, you get sensitivity back.
Right.
You get increased nerve flow or nerve formation, increased blood flow. And that's what's happened is all those have receded because the cell's not healthy, the hormones aren't optimized. But again, we need a little boost with those growth factors.
Absolutely.
And then did that hurt, the nipple part?
No, it was weird, but it didn't hurt. You numbed.
And just a little, little shot underneath, just one shot on each side, very minimal discomfort, but amazing results. Amazing. And again, breast surgery of any sort will have decreased sensitivity just with that. So a lot of
breastfeeding too.
Breastfeeding is a huge one. Yeah, those kids are rough on us, right?
They are.
Yeah.
They take it away.
I know. They take it away. We give to them and they take it away,
They do.
Right?
Yes, they do.
So we have sensitivity in the nipples. And then again, so when we get to the procedure, the staff is awesome about talking everyone through what they'll have done. So, they'll draw the blood and start processing that. And then basically they're going to go ahead and start with the Votiva treatment first, or whatever laser that we decide upon. Again, I love Votiva for the reasons that we can focus that treatment on the anterior vaginal wall if orgasmic strength is a real issue and urinary incontinence, but we can go on to the outside. We can decide, between the patient and the provider that's doing it, we can decide where we need to focus that energy. And that just heats the tissue. And then the reason why I like to do the ohsot on the first one is because basically we've heated all that tissue and then we're dumping a lot of growth factors into it to stimulate all the growth. So when you heat it, you tell it it's injured. And then you dump a bunch of growth factors and then you really get a lot of improvement with it. And so the clitoral shot, any discomfort there? No.
It's kind of one of the easiest things, but you worry about it before you go. But then you're like, why?
It's not until you actually get through it that you can relax and know. And now you'll know in the future that it doesn't. It's not. There's not discomfort with it, but
very much worth it.
And I agree. Like it's amazing what you can do. And again, there's no surgery that helps. And there's no medicines that help.
Right.
Like nothing is bringing sensation back. There's not any options. If you have urinary incontinence, there's surgical options, but it doesn't always improve things. And I say, as soon as you cut on something, you potentially are messing with blood supply. It may not function, it may not even be 100% improvement in what you have. And again, you've made an incision of some sort where this is just regenerative.
Yeah.
We're using your own blood to regenerate. Honestly, like when a patient comes in, again, everything is explained. The blood draw is done. We'll proceed with the laser when processing blood. And then we're going to put some topical numbing medicine on the area to be injected. But then we'll also come in and after that do a block that really helps with discomfort. But we talk you through it the entire time. And again, because it doesn't matter how much you say it doesn't hurt. They're not going to believe it until you actually go through it.
Right.
And I get it. I've been there, multiple times. So, but again, no pain at all.
No.
Yeah. All right. I love it.
And no pain the next day, nothing.
And no downtime with the non-ablative procedures. And so, again, a lot of women will feel engorged after an ohsot. And so actually, sexual activity might be something they want to do. And so we encourage that. There's no downtime because we're not actually ablating and it's not painful like some of the ablative procedures are. And so that's the big difference. And then again, hormonally optimizing all that too in combination all works very well together.
Yes, right? It does.
What are some of the things that might help you decide on a location? Because I always say they need to find somebody that's a fit for them. And again, we're in Knoxville. And when I launched my business, I was doing a lot of wellness and aesthetics and didn't really even know sexual wellness at that point existed. And then as you educate or do another, conference and you meet people, then you find out, and Dr. Runnels is the doctor that developed the ohsot and pshot. And mainly it was developed for urinary incontinence, but then they had the side benefit of increased orgasmic strength. So we've come a long way with that. And now he's definitely done a great job of getting information out there so people know. But I always say finding a fit that's right for them, making sure you're comfortable with the office, making sure it's a fit for you, a fit for us, so that, women want to feel better and aren't so afraid. And so is there any advice that you would give to somebody maybe outside of the area that might be looking for?
For years, I have searched this over and over again, even things at home. You look for a home device all the time. Mm-hmm. I was not going to have the surgery. I've seen the pictures. There's no way. I probably wouldn't have went further, but they text me and I don't answer the phone. I'd let somebody leave a message and I would have not called them back. So they text me. And so when I came to see you, it was for the hormone pellets that you do to get that optimized. And then after I talked to you and you had a game plan, okay, that's how we made it before I knew it. But I'd always looked for that.
And Ellen is very decisive. I will say that. There's when she decides that when she gets the information, again, she's not going to make an uninformed decision, but she makes decisions, processes and makes decisions fast. And I think what you do is bring up a key point. I think that for us, the thought behind texting, and again, when you're not a patient, you can text our business line and you can call, because I, like you, it would go to my voicemail, which actually always says full, even when it's not. That's an Apple issue, I think. Even when I clear it out, it still says it. But for the most part, I never answer my phone and I don't listen to voicemails.
Only text. That's all I do.
Only text as well. And, I'm better with text than I am with email. And again, I'm not that tech smart either. And so I kind of base a lot of the things we do on the fact that I'm tech simple, but text is easy and I don't want to answer the phone. So I think texting patients is a great way to do it. So we'll always call first, and somebody doesn't answer, text them so that we can get them in. And because I think that's the way I would respond.
Well, and then, after you meet people, you decide, well, am I going to do it or not based on how comfortable you feel or how knowledgeable somebody is, right? So I'm like, schedule it. It's on. Let's do it.
Yeah, no, she was ready to go after we talked. And again, if Ellen comes with hormone, symptoms of hormone decline, which again happens to every woman, it just depends on when. It can be anywhere from, I always say 45 to 55 is perimenopause, but honestly, it starts in the 30s sometimes now with birth control, childbirth, just toxicities that we're exposed to. We're not making it the way we used to. And so it can happen earlier now. And so when they come to me for that, we start the conversation with the hormones because that's where their focus is and how they want to feel better. But we always do a questionnaire that talks about sexual function too, because there's such an overlap and they work together. But I can't do any, and when somebody comes to me for any kind of sexual issue, then it's hard for me to get them results that are going to last if we're not hormonally optimized. And so we're talking about hormones because again, it's a comprehensive approach to it. And again, you can optimize, you might get a little bit more sex drive, but maybe not the sensitivity and arousal that we had. I have not seen orgasmic strength ever come back or urinary incontinence with just hormones.
Right.
But yeah, so we'll talk a lot about just the regenerative and the options available.
It just makes you have more energy and feel better, but there's more to it than that.
More to it. Got to do the local. What about ohsot? Had you heard about the ohsot prior to coming
Never.
in? Yeah.
No. And so like you sit in the room where all the pamphlets are and I'm collecting them all, before I met you. But after we talked, you knew what exactly I needed. I asked you and we went on that plan and that's awesome.
Yeah.
So it all works together.
It does all work together. So she just got done with her second Votiva. And again, so that just is a cumulative effect. So what she got with the first one with improvement of urinary incontinence and then orgasmic strength will even get better with the second one. And so every touch point, I say 3 weeks to 3 months, but it is amazing that, And I don't know what the science is. Maybe that space in between the urethra and the anterior vaginal wall, maybe the fluid stays there. So it already supports the urethra, because most of the time when we're injecting PRP, it's going to dissipate but it's going to work its magic and then dissipate and then work its magic over 3 weeks to 3 months. But for whatever reason, a lot of women with that first ohsot, and likewise me included, get immediate improvement. Even in urinary incontinence, which is the harder thing to improve. And a lot of women just with one ohsot, I will say that sometimes it might take 1, 2, or 3. There's been an occasional woman with more severe symptoms. And again, you can't guarantee how somebody will respond, but Ellen's response is quite normal. That like that first Votiva and ohsot are very good. And then we'll follow that through with at least 2 more laser treatments, usually separated by a month. So she's done with her second. So 3 weeks to 3 months from that. And then again, we'll hit it again and another month after that. And then it'll be 3 weeks to 3 months. And then usually we'll kind of assess. That's the end for right then. There's never too much, again, PRP and laser. So it's, if somebody wanted, like, say, for instance, orgasmic location. So, we even have an intake form that talks about orgasms, like clitoral versus vaginal versus both. And like 80% of women will say they've never had a vaginal orgasm. So it's amazing that they feel like they're the only one. So they don't feel, like that they're normal. But in fact, it's very common. But those women can attempt more ohshots. I don't want to do a P shot. More ohshots because they could get more sensitivity. And potentially, it's the only way. It's still not a guarantee that they would get vaginal orgasmic strength if they've never had it. But there's a chance, and that would be the only one. So sometimes, 1, 2, or 3, but typically that's the pretty usual pattern, is we do 1 with the first Votiva, repeat 2 Votivas, and then usually you're more on a maintenance plan after that.
How often do you do the ohsot?
Usually once a year, about once a year. But again, it varies per patient. So sometimes patients will not experience any decline in orgasmic strength or urinary incontinence for, a year and a half. And so that's individualized. I think I would prefer not to get there again.
Right.
And so I always recommend usually a Votiva and an ohsot at least yearly, unless if they're trying for super, orgasmic strength or sensitivity, or, there's that occasional patient that we might have that doesn't have improvement with urinary incontinence. But
what made you select Votiva over any other?
So I think that Votiva, so there's lots of lasers. That's a good question, because there's so many lasers. And actually, the Fotona is the other laser that we have, and they have an intimolase procedure. And I actually looked at that laser first, because that laser does lots of different treatments. So it does facial stuff. It does a ton of different treatments. And so when I was purchasing my first laser, I thought, well, I think I want that one that does everything, and I can have one laser doing everything, right? But then it's a very hard machine to work, and it really does take very knowledgeable people to work it, because you can adjust all the settings based on what you want to achieve. And so you have to be careful with that too, although it is still a non-ablative device. So it's a little harder to use, but it doesn't allow you the flexibility of focusing in on a certain area, because the laser is actually doing all the work. So if it's incontinence, it'll actually do just the anterior vaginal wall. And it does it automatically with settings. And then if it's, vaginal tightening, and, because you can also get tightening, because we get laxity with childbirth. So that's another thing. And so it does the whole vaginal canal, but it's still the laser that does it. And honestly, that machine, so hard, it would have been probably me just doing it initially. So I had not purchased that machine. And then I had at least 3 or 4 different reps come in. And then Edmode came in with their laser device. And I just loved the ease of use and the fact that we could focus it in, and it wasn't uncomfortable. And actually, again, with transparency and kind of a funny story, is they came in. It was 2 reps, and they brought that machine in. And then they brought 2 other machines that we were looking at, and we actually have in the office now. my staff was willing to try the other machines, so people were up there doing like an IPL and body contouring. They were up there doing the body FX. And then we got to the vaginal machine, and none of my staff would volunteer as a patient for the demo. So I'm like, I'm up there. You're going to do it. And so, of course, I ended up being the patient, which my entire staff was a little shocked by because they didn't want to do it. But again, I'm not going to purchase a machine. I'm not going to know. I need to know what the procedure's like. I need to know what it feels like. Is it painful? Is it hard to use? And so basically the 2 reps were in the room, and they were behind me because, of course, they weren't doing the procedure and the nurse was doing it. So basically, I think those reps still get read today when they come into the office. But again, I had it done. It was just a very comfortable. The results were there, because we didn't purchase it that day. And then you also could see, if it was painful at all, if you had any downtime, any swelling, how hard it was for the nurses to operate. So it was just a fabulous machine. So that's the story for how I decided on Votiva. And again, I had at least 3 other companies in before I made that purchase. And so now we do have the Fotona 2. But again, it doesn't allow you that focus ability. But if somebody has any darkening, which is another kind of common complaint, you can actually improve that. You still get some tightening on the outside, but you can actually decrease pigment, which some women find to be very problematic, where they don't have any loose or redundant skin on the outside, but they have some pigment issues. Yeah. Did you have anything on the outside that we needed to address?
I don't think so.
Did we take pictures of you when you
No.
went? Yeah. I'm surprised. So I always, and again, the staff, I think occasionally will not think to do the pre-pictures. And so I always remind them. And sometimes if I don't remind them, because I'll come in and do that vaginal exam prior to the first treatment. And a lot of women don't want the pre-picture.
I wish you would have.
I know. Well, and that's so, and often I talk them into it because they'll say no, and the staff has already mentioned it. And I'm like, again, you don't have to look at it if you don't want. And it stays as part of the chart, but then you can see improvement because if there's anything on the outside, it just tightens the whole outside. And again, you're hitting the clitoris, which gets increased sensitivity in the clitoris. And I will say that the Fotona has a great clitoral treatment where you can just focus in on the laser with the right on the clitoris. And it takes about 5 minutes or so, and it brings stem cells to the clitoris. And it's pretty amazing too. So, and you're just in the clitoris, again, we only see part of that, right? And it's the female equivalent of the penis, and it's just strictly there for sexual function and sensitivity. But it does have like essentially 2 legs, as you know, like 2 legs on each side of it. So I don't think any vaginal orgasm is ever not have a component of clitoral, stimulation too. So you're actually hitting those legs in addition to the part that we're seeing. So with the Fotona, just an FYI.
All right.
I'll bring it up when you're in the room, or when you're in the office next.
You should.
Yeah, I won't forget now.
See?
And I can't believe they didn't take the pictures. That's too bad.
I know,
yeah.
And I didn't even think about it myself.
Yeah, because again, a lot of times people don't know the improvement until after they see it. And a lot of people will feel tightening on that initial treatment, and they'll feel tightening on the outside. And I've had at least 1 or 2 that have come in and that haven't wanted internal tightening, but have had some issues on the outside. And so we'll just do double that amount of time on the outside, where the Fotona doesn't give us that flexibility. And so again, Votiva is like my favorite treatment. Votiva is my favorite machine to use right now for vaginal rejuvenation. Might be my favorite treatment too, but yeah. And besides the ohsot.
Right.
But, again, it's comfortable. I just want to, the conversations need to be had. And I don't think that people have a lot of options for that. Did your OBGYN doctor ever have anything to
I had
offer?
asked her about it, and she's like, well, you're just just this. Well, I'm not just anything.
I don't think they have solutions.
They're probably like, give it up.
Yeah.
And I'm not giving it up.
And you shouldn't. And I think that these conversations need to be had because, again, what you're doing is helping other women understand that there are a lot of things to do, not be afraid to take control of that. And I think that I find women a little hesitant versus men. Men have research, they come in and they're ready to buy, but it's an objective functional change that they have, right? Mm-hmm. Everyone can see it when they start to have changes where they can't with us. Maybe that's part of it, or maybe we're always taking care of other people. And so we don't put ourselves first. And so they're a little more hesitant to actually, really think that they're worth, the cost of vaginal rejuvenation, a comprehensive one. And so I think having these conversations just allows them to know there are options. They're not painful.
And they're so easy.
And effective and painless.
And just surprising easy.
Well, I'm glad that you came on. I really, really thank you for coming on and talking to everyone about it and being, transparent with the procedures. And, I think women should actually just know, like, again, if we can take control and prevent anything from progressing, that's when you want to do it.
Yeah.
When it doesn't take much for us to get that sensation back.
Never again. I don't want to go backwards.
All right. Well, we won't let you go backwards.
Nope.
No, not at all. So, well, thanks for being on. And again, Ellen Phillips, she's with Believe RX. She's a pharmacist here, owns a great business, and has absolutely the best bowls. Actually made me cheat on my fast today, so I'll have to start that another day. But well worth it. So, and I really thank you for coming on. Again, this podcast, Rev MD Sexbytes, is meant to bring solutions comprehensively to men and women, good information, solid medical information, conversations that we can have. So, there's solutions out there, and talk about them and open those conversations. So subscribe, put any comments in that you might have, any questions, anything in the future you want us to talk about, because again, we're willing to deep dive into anything sexual wellness. And we're here to revitalize your look, your health, and your sex life. Thank you. Thank you, Ellen.
Thank you.